Hi, and welcome to Peak Life. I'm Karen Myers. Today we're going to be talking about National Fentanyl Awareness Day. And joining me is Kristen Martin from Chesapeake Integrated Behavioral Healthcare. Thank you for joining me.
Of course, thank you for having me.
So what is National Fentanyl Awareness Day?
So since 2013, we've seen an alarming increase in deaths due to illicit fentanyl, which we'll get into in a little bit on what illicit means. And so we are really trying to get the word out and spread awareness about illicit fentanyl. And this year will actually be the second annual National Awareness Day for fentanyl.
And what day is that?
Tuesday, May 9th.
Tuesday, May 9th. So what is fentanyl?
So fentanyl is a potent synthetic opioid. So potent meaning it's very, very, very strong. It's 50 times stronger than heroin and 100 times stronger than morphine. Synthetic means it's man-made. It's not natural in any form. It's made by people. And opioid means a pain reliever, and it only takes a few grains of sand size to kill someone.
And that's amazing. We were talking prior to the show about that. And you have to visualize that 2 grains of sand can take someone's life.
So next time anyone goes to the beach, look at what a grain of sand is, and it only takes a couple to kill someone using fentanyl.
So how are people ingesting fentanyl?
They don't know it a lot of the time. That's the scariest part. You can't see it, you can't smell it, you can't taste it. And a lot of times it can be in anything. It can be any kind of drug can be laced with fentanyl. But what they're seeing a lot of now, especially the DEA last year, sees 50.6 million counterfeit pills laced with fentanyl. And you can't even tell the difference. These drug makers are very, very smart. And a lot of times you can't tell the difference between something that's medically prescribed to you versus these counterfeit pills that they're creating. They look almost identical.
So you say it can be in anything. Does that mean marijuana?
Marijuana also.
Which is now legal in the state of Virginia.
And marijuana is grown through a plant, yes, but these drug dealers are also cutting it with fentanyl because it increases the potency of that marijuana effect, but it's also killing people. And again, it only takes a really, really small amount. So it can be in anything.
So why would someone do that? What is the reason that a supplier, if you will, would put fentanyl into a product?
It's very cheap. And at the end of the day, remember, it's a business for them. And they're not really worried about people's health. They're worried about making money. And it's cheap, so a little bit goes a really, really long way. And it's killing people. And it's killing way too many people. In 2021, 45 Chesapeake citizens lost their life due to fentanyl ingestion. And in the first quarter of 2022, it was 17 people. And if you look at the Chief Medical Examiner's report from 2021, 76.5% of overdoses were either caused or contributed due to fentanyl.
And so you say 45 people lost their lives. That's not counting the people who overdosed, who were fortunately saved.
Exactly.
And this is not just, of course, it's a national problem. It is right here in our own backyard in Chesapeake.
It is.
So what can we as a community do about fentanyl overdoses? And I say that because I know not everyone may think they're connected to it, but they are in one way or another, whether it be, economic or know somebody who has been down that path.
It affects us all directly or indirectly. So one of the biggest things you can do is learn the facts. And it's a relatively new problem. This has really started to grow since 2013. So we're looking at about 10 years. So even as a mental health and substance abuse professional, we're still learning all the time. So learn the facts. DEA.gov has a lot of really great information on fentanyl and a lot of other awareness facts that you can share to your friends and your family. And one of the scariest pieces is that we're seeing a very big uptick in the deaths among youth due to fentanyl. So you're never too early to start to talk to your kids or the kids in your life about drug use and the facts about it. We also, Prevention Services at CIBH, also have Revive training. So you can request the Revive training or come to one of the ones we already have scheduled for the public. And during these trainings, they're only an hour, so you're not looking at a huge investment of time, which is great. And you're learning about the signs and symptoms of an overdose. You're learning about addiction, how addiction works, and how to respond to an opioid emergency using Narcan. And one of the really great things, if you come to our training, which is virtually or in person, you're offered a free dose of Narcan at the end of the training.
And even if you can't get out virtual, just if you know someone who might find themselves in that situation, just to take that time of an hour to find out what you can do if you find yourself and can save a life.
You can save a life. It could be literally the difference between life and death.
So I guess I'm still like just dumbfounded by how this has become such a huge issue. And education, of course, is key. So, are schools participating in the education, or I'm guessing a lot of younger people may have connections and they're not really worried about like that this may be in whatever product they consume.
A lot of youth think that they're immune to all this bad stuff in the world, and the harsh reality is that they're not. And a lot of drug dealers and the drug world will target youth because they're trying to get to them young, so that they're creating someone who wants to use for the rest of their life. So it's really scary that our youth are being targeted. We go to every single tabling event we could possibly go to. We're working with the schools, and we actually are scheduling some marijuana presentations with the schools during September. So we're getting there, and we really are trying to get this information out to anyone and everyone in the city. We're partnering in some projects with the region to try to get this information out there, because we want to save lives and we want to prevent this from ever being ingested by anyone.
And I know that I've been working with CIBH, Chesapeake Integrated Behavioral Health Care, on doing a special series for a closer look to talk about opioids and the fentanyl issue that we're experiencing specific to our city. So how can someone seek treatment for addiction?
So you can come to CIBH. We actually have the medical assisted treatment program, which includes Suboxone, and they can come to our office and get enrolled in that program. We also have intensive out treatment, which can be groups or individual therapy. And then of course there's also community resources, crisis destabilization centers. You can go to an emergency room and they can help you with the process. So there's a lot of different avenues. It's a really good point to make that if you're pregnant or are a mother of small children, you get up on that list, because we know that you're taking care of children and they need you, so you can get priority in that case. And also you can always visit CIBHprevention.com for some principal resources and all the contact information for our center.
Okay, well, Chris, this is just so much to take in.
It is.
But it's out there and it's real, and talking about it is one way to educate people.
Talking about it is part of the battle. It's just getting the information out there and destigmatizing this drug, because it's out there and you can't ignore it, and we want to help our citizens.
And it can affect anyone.
It
Doesn't
can
matter
literally affect
what your
anyone.
economic status is or
Yeah,
social
and
status.
that's one of the things is a lot of people think, well, this can only affect someone who may be struggling with addiction already. It can literally happen to anyone. Like the financial crisis, inflation. Think about it. If someone can't afford their prescription drug pills, they may be forced to seek stuff elsewhere.
Exactly.
And that pill that looks exactly like what they get from the pharmacy may be a counterfeit pill that is laced with fentanyl. You just really never know.
I did want to ask, is there a way to test it?
Yes, there's fentanyl test strips. They're very cheap and expensive. You can get them through us, through our rescue drug bags that we distribute. You can also get them from even retailers like Amazon. And you can find out results if fentanyl is in that drug within 5 minutes. The only thing that people need to remember is that they cannot tell you how much or how strong the fentanyl it is. It can only tell you if fentanyl is present.
Which is a red flag.
Yes, exactly.
Definitely. All right. Well, thank you, Kristen, for coming on to talk about
Thank you so much for
this
having
very
me.
important topic.
Yes.
Appreciate it.
Thank you.
And thank you for joining us on Peak Life, and we'll see you next time.